Hello and welcome back for this week's episode of Clinic Conversations. And this week we are back with Dr. Snyder, plastic surgeon here at Rapid City Medical Center. How are you doing today, Dr. Snyder?
I'm doing great, Jack. Thank you for having me back.
Yes, no problem. So do you want to just tell us a little bit about you and what you do here at Rapid City Medical Center?
Sure. So as you mentioned, I am a plastic surgeon. I have been in practice for 13 years. I've been in Rapid City for 6 of those years. My practice is primarily breast and body. I see patients of all ages. What we're talking about today, breast reduction is the most common surgery that I do.
Oh, okay, awesome. So do you want to just tell us a little bit about what a breast reduction is and why somebody would get this done?
Sure. So breast reduction essentially is reducing the size of the breast. It's a surgery that is done primarily for patients whose breast size is too big for the rest of their body. How it is. A lot of times those patients will develop back pain and neck pain, sometimes skin rashes underneath and between the breasts, and certainly shoulder strap grooving. So it's a great surgery for reducing the size of the breast and basically making it more compatible with the rest of their body. How it is.
So what's the health benefits that come along with a breast reduction surgery?
Well, most of my patients report an improvement in their back and shoulder pain almost immediately, even sometimes the day of the surgery or certainly the few weeks afterwards. They see increased levels of activity. They definitely have improvement in their posture. Some patients have alleviation of headaches. I've even had patients that have numbness and tingling in their hands and fingers that have gone away after breast reduction surgery.
Do you want to just talk a little bit about the typical procedure process and if there's a lot of downtime and I guess what patients can expect from the procedure?
Sure. So this is a surgery that is done under general anesthesia. It takes between 2 and 3 hours in most cases. And those patients wake up relatively sore, but not horribly sore. They're typically on pain medicine for 3 to 5 days after surgery. And then they are just taking Tylenol or ibuprofen. Most patients will take 1 to 2 weeks off of work. And I do limit their activities. They're not able to lift anything heavier than 10 pounds. They can't do any exercise other than just walking for those first 2 weeks. After that, I usually release them to a 20 to 25 pound weight limit, and then they're able to do light aerobic activity.
A common question you probably get is this covered by insurance? So do you want to kind of touch on that a little bit?
Sure. I would estimate that 95% of these cases can be covered by insurance, and it's because it truly does have health benefits. And those patients that have back pain and neck pain, as long as it's well documented by their primary care providers, most insurance companies will cover this. Occasionally they have to do a short trial of physical therapy or have been seen by multiple doctors to have enough documentation in order to get insurance to cover it, but I normally do not have problems getting it covered.
All right, so how can listeners learn more about this procedure?
Well, we have a lot of information on our website at blackhillsplasticsurgery.com. Alternatively, I'd like to see patients in the office if they're considering breast reduction surgery. It is helpful to have a referral from their primary care doctor, but it's not required.
Okay, awesome. Thanks so much.
Thank you.